shift into two of the things that are warning flags for people to make them more susceptible to COVID or any other virus is type 2 diabetes and hypertension. Let's talk for a bit about your take on what we could argue in most cases are highly preventable conditions that may be difficult, but we can shift out of these spaces. So tell me your thoughts.
Well, what's called metabolic syndrome is basically a confluence of things that are all part of the same picture. And that includes high blood pressure, diabetes, high cholesterol, a big tummy, a little bit of kidney damage. You know, they're all part of that, what we call metabolic syndrome, which is basically low-grade inflammation, possibly originating in the bacteria in your gut, inflaming the fat tissue of your visceral fat that makes your blood vessels mad and they constrict. So you call that high blood pressure, and making you insulin resistant. So your blood sugar climbs, so we call that diabetes. But they aren't separate illnesses, they're linked. And when they're based on low-level inflammation behind the scenes, you've already got this destructive low-level grade of inflammation going. So when the COVID virus shows up, your immune system is already being beaten back by the inflammation that's going on. So the question is, how do you rebuild your immune system? And I'll just give you one example. We now know that if we give you a drug called metformin, metformin was found in France in the mid-19th century, 150 years ago, when a doctor and a pharmacist in a small little town knew that there were these little old ladies that were giving ground up French lilac to control sweet urine. And they said, can we extract the drug from that? And they extracted the product of it, and they found metformin was born. We've had metformin around for 150 years. So you could make the argument it's sort of a plant or an herbal extract, but it's the #1 drug in the world. Most of the world, you can buy it over the counter for 2 cents a pill. In America, it's a prescription drug. But what's totally fascinating is we now know where metformin works. It isn't really just a diabetes drug. What it is it gives your mitochondria a sense that there isn't as much energy as you'd like. And so you get a rebound. You get a rebound from that. And that rebound is that you turn on AMPK, which is one of your markers of sufficient energy. Yeah, I don't have enough energy, therefore I better go into starvation mode, therefore I better hunker down and slow down these processes so I live longer. So this is part of the whole topic on how to live longer, but you do the same thing when you exercise rigorously. When you exercise rigorously, you make your mitochondria nervous that they don't have enough energy, so they hunker down and say, let's live longer. And your immune system gets better, and you live longer. So exercise is spectacular. But metformin does the same thing. Well, not only does it turn on AMPK, but it also turns on your immune system, and you get a rebound of your immune system. And there's a whole bunch of elaborate mechanisms known for that. Okay, let's fast forward. Let's look at 270 Chinese people in Wuhan, China, who have diabetes and COVID. Back to COVID. 102 of them were on metformin because it's the #1 drug in the world. 178 weren't. Okay, they actually turned out to be almost exactly matched in age and gender and all that stuff. Both groups stayed in the hospital 20 days, but the metformin group only had a 3% mortality. The non-metformin group had a 12% mortality. Which group do you want to be in? The 3%, the 12%? I want the 3%. I'm taking metformin. Everybody should be taking metformin. We should have the entire American America should be on metformin. Now, should it be observed? Yeah, you probably should be monitored by a doctor, but you don't need to have a dose so much that it lowers your blood sugar that much. I've actually been taking it for a year just for its anti-aging effect, because it's basically, it's exercise in a pill. That way I don't have to go to the gym.
You're crushing me. You're going to put me out of business.
Actually, it doesn't quite do that, unfortunately, but it's sort of the same field. But it's a good joke for the talk.
Exactly.
No, you should be on metformin, even if you're not diabetic. Not at the level you'd trade a diabetic, you should be at this level. But because it's got anti-aging effect to it. There are multiple examples of metformin in cancer. If you take 220 women with breast cancer, and with stage 4 breast cancer, the women who had metformin lived 40% longer. 40% is a good number when you have stage 4 anything. So metformin has huge impact because it makes your immune system hunker down, and then you get the rebound. And it's that rebound of learning to use our immune system. You get the same rebound when you run 5K. I want you to run 5K. I want you to get sweaty. I want you to do your curls until exhaustion. You're doing the exact same thing when you're doing that. They're all different complementary fashions of building resilience. You get the same effect when you fast. When you go through intermittent fasting, you're putting your cells into slight ketosis. And ketosis is saying, there's not enough calories around, I better hunker down. Well, it's not the hunkering down, it's the net effect after the hunkering down where you get an immune system that rebounds. And that's what you're looking for. You get the rebound of stem cells and immune function. Is that cool or what?
Well, it's a pile of things. It's really cool. As I'm reading headlines, maybe not the whole articles, but there's so many headlines out there. It is cool. What is also a bit frustrating for me is there's so little conversation about us doing simple yet possibly difficult steps and inexpensive steps to take control of our health outcomes. It seems like, with a broad brush, we're collectively waiting for somebody to solve this for us. And we're going to continue eating, starchy, sugary, processed, not drinking enough water. There's sleeping horribly, and we're not taking care of the simple things. And what we're talking about are relatively simple, inexpensive ways for us to go, I'm not going to wait for somebody to figure this thing out. I'm 60 pounds overweight, or I'm 40 pounds, I'm pre-diabetic. Stop it. It's hard. I'm cheering you on, but you can do this.
That's what I spend all day long. My belief is, and I've seen it from experience, that once people see their own data and have it framed in the context of their self-interest, people can lose weight, people can learn to exercise, people can learn to change behavior, and they can manage themselves, but it requires education and being framed in the context of their own data. They need to have the right blood test done on themselves to show where their markers are